Rheumatoid arthritis is a chronic autoimmune disease with inflammation of the joints and the membranes that surround the joints. There are a number of genes that causes the disease, but also environmental factors that can contribute to the disease. Rh-MSE genes that causes the disease are known to be the same ones that causes rheumatoid arthritis. The Rh-MSE genes produce antibodies that causes inflammation in the joints. When the MSE genes are inherited, a person has a 20% chance of getting the disease. Another 20% of the Rh-MSE genes will cause a Rh-MSE negative person to get the disease. There is a specific type of immune system that causes the inflammation and arthritis, and it is the Rh-MSE negative type. The person who doesn't have the Rh-MSE genes can't get Rh-MSE defective cells to cause inflammation and arthritis. The main way to prevent this disease is to take medicines and supplements that reduce inflammation and prevent the disease. Also, a person should try to avoid cold weather, rain and snow. Try to get some exercise, keeping in mind that an arthritis sufferer isn't supposed to be standing for long periods of time, they shouldn't be running. Exercise is good for the heart, but it's important for an arthritis patient to avoid an injury. You should try to keep your weight down. If you have arthritis, you should try to avoid high levels of cold. Such a person should try to wear clothing and shoes that are breathable. Another thing you should avoid is sugar, salt, caffeine and alcohol. You should also try to avoid certain foods. You should avoid them, such as fatty meats, eggs and milk. These are the common ways of the Rh-MSE genes can cause and increase inflammation and pain. The other ways of the Rh-MSE genes are less common and are not as commonly known by many people. In order to help you, here are some things you should try to help prevent and cure this type of arthritis. They are not things you should do to cure this type of arthritis, but they are ways that will help you reduce your pain. They are ways that you can use to relieve pain and treat your arthritis. What are the available solutions of rheumatoid arthritis? The common treatment for rheumatoid arthritis is surgery, because the pain can be disabling and hinder the daily activities of patients. The usual option is the replacement of the joint. But surgery for rheumatoid arthritis is a last resort when no other treatment works. Another option is the medication. There are a variety of medications that can ease the symptoms of rheumatoid arthritis, like painkillers, NSAID, steroids and DMARDs. But it's not a cure for all the symptoms, and it may have side effects. The third option for patients is maintenance, a process where the patient keeps a healthy diet, exercises, and avoids stress. But some of these medications have severe side effects, so it's better to avoid them if possible. The most common option is the medication called NSAID, also known as non-steroidal anti-inflammatory drug. The side effects of NSAID are stomach bleeding, and may cause temporary dizziness and temporary sedation. These symptoms are less likely to happen with longer use of the medication. NSAID is recommended for mild pain and mild swelling of joints, but it can cause digestive problems, diarrhea, gastritis, and increased uric acid levels. Some of the side effects are nausea, headaches, dizziness, and drowsiness. The risk of side effects with NSAID is so great that it's better to go for the other medication, if you can. But the medication can have other side effects like stomach ulcers, hypertension, and stomach bleeding. Another medication, DMARDs, is another option for the pain relief, and for the reducing of the inflammation in the joints. But these medications can have many side effects that can be dangerous, like nervousness, hyperactivity, liver dysfunction, and bone marrow suppression. Side effects of DMARDs include nausea, vomiting, headaches, rashes, lymphadenopathy, hair loss, cataracts, and a tendency to diabetes. Rheumatoid arthritis causes swelling in the joints. The knee is the most commonly affected joint, but it can happen to any joint. Most common symptom of rheumatoid arthritis is pain and swelling of the joints. Pain in the joints is the most common symptom, and it can affect any joint, including the finger joints and the joints in the spine. Pain that is accompanied with swelling in the joints is known as rheumatoid arthritis. Most of the people are affected with the pain in the joints in the morning, and some people can feel the pain in the joints even at rest. These symptoms often occur together with fever, weakness, and fatigue. The treatment for all of the types of arthritis is the same. The treatment of one depends on the other two. NSAID, to reduce the inflammation in the joint. This is one of the medications that you need to avoid. This medication has many side effects like headache, vomiting, rashes, and diarrhea. DMARDs, to reduce the inflammation and the swelling in the joint. These medications can also cause bone marrow suppression and kidney toxicity. These medications should not be taken by pregnant women. Thank you for watching. If you got some value from my video, subscribe to my channel as it enable me create more valuable informative videos for you.